wire, please. Knife, please. Okay. Can you hold the board? You got it? Artric it. Artric it. It's just the board, that's all. Just do this. You okay? Scissors, please. Yeah. And if you take those out, okay. That's fine. Okay. Mm-hmm. What I like to do is just bury these wires a little bit. So we're burying the wires in the cartridge. Yeah, and just pull it. Where's the article? I'm not sure we're going to have much left, to be honest, because, well, there might be. I still have to do. Yeah, leave a little. Okay, but I still have to do the tragus, and I'm thinking, I haven't decided about. Yeah, you can stop for now. You can get hemostasis in. So now we're going to stitch this another wire, please. One second. Force it to me. Okay, I'll check it. I'll check it. Gift. Some more gift. What's important is to put what's called a projection block. To be honest with you, once we put the projection block, I'm not sure we need to the helix. I mean, we'll see. Let's just see. Let's see what we have. So this is good. So that's what you can have. I don't know if it's any use to you, Ahmed. Let me see. So we need a projection block. We need a tragus.
Can you just talk us through
Yeah.
where we are, what's left?
So this is an important piece. We connect between the earlobe and the root, and it allows us to fix the root in that position and to put the tragus on there. I also want to add a projection block. That's quite important because it gives depth to the concha ball. Now, when you add a projection block, remember you are putting more tension on the skin. So you've got to make sure you've got enough sufficient skin. This is quite a nice pen piece. So I can use this for the tragus. There's also that. So if we use this as a projection block like that, can you see that? And that for the tragus. Okay. See that? Makes it much better. Can I have wires again, please? So this is called a projection block. Another wire, please.
Dr. Walid, so
Yeah.
where do you prefer to place the block for elevation?
For elevation.
Yeah,
Well,
I mean,
normally,
is it behind the helix or the anti-helix?
this is not for the second stage. This is to give you a better concal ball,
Yes.
more depth. And when you do the second stage, you can just put a graft. You don't need another projection block. It's already got a little bit of projection. Again, this, because I'm in two minds. Well, I'm not in two minds anymore. I don't have any more cartilage left. It will help me because my helical rim is not very strong. So by elevating it, I can give it more visual presence. So I think if we get a nice tragus, we've got all the elements of the ear, really. So just articulate, please. We need that for the tragus, don't we? Hold the block. Can you cut short, sort of, next to the scissors, yeah? So this projection block, I think, is very useful. How is the pocket? Are you happy with it? Not perichondrium, I mean the ear pocket. Right, you need help with that because you need to get good hemostasis as well. I might put one more wire just in the top one. Scissors to me, please. One more wire, please. Can I see? So we really are relying on the skin to try and give us some definition. No. Okay. So we have the projection block. We can slightly. Gives a little bit more concal ball. So I think if I manage to hollow this out here, oh, there's a wire there now. we can see. Do you have a swab? Let me just see how that looks on top. Maybe some betadine. Yes, just a little bit on. So with that block, I can just, if there's enough skin, yeah, I think we have quite a reasonable rim. Do you agree? I may slightly thin the. So I use this technique to just try and give me an idea how it's looking. So we have obviously this is much thinner than the skin. So I think you're seeing a little bit more than you would through the skin. It's more psychological for me. Yeah, just to sort of think, right, it's going to work. I think that's good. We just need a tragus. And yeah, no, I'll be okay with that. We don't have a choice. So can everyone see the definition? No? Yeah, they can. So it's really important to make sure that tragus is not too close to the concha ball. So what do we have? I think we're going to have a nice spare bit. Wonder if we should store this for the second stage or use this. Let's see. I don't want a very big tragus. Okay, pen please. What am I doing? Hold on. This is going to be this way, isn't it? So I need it.
Is this a tragus that you're carving, Dr.
Yes,
Walid?
yeah, yeah. Obviously, the more bulky it is, the more it adds on the skin pressure. It's a bit too bulky at the moment. fresh plate, please? There's this Indian surgeon, who I think I mentioned him to you. He's anaesthetist, female. She carves the rib while yeah, she's so good. It's her hobby. Yeah, yeah, I worked with him. It's so. It took him a long time to get good results when he first started. He's an ENT surgeon, but his results are good now. I need a fresh blade. Ah, he just harvests the rib, does the pocket, she carves. They're a team. I suppose in India I don't think that would work here, would it? Pen? Yeah, 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 yeah. Well, this proves my point in the sense a lot of people don't find this the problem. The problem is the planning. Well, I actually find the planning. I mean, I've always been slightly artistic, but I've never been a real artist. I'm more of a plastic surgeon than I am an artist. Does that make sense? But many ear surgeons are very good at drawing. Nagata used to draw all his diagrams for his papers. Himself. And they were amazing. You should see them. They're amazing. So that's why we're not all created equally. So now I'm reaching a point where if I thin it a lot more, I might lose what I'm trying to achieve. But if I don't thin it, also I'm thinking of the skin always. See, I'm trying to create a concavity. It's like a false meatus. So I would like this to be further out. Wire, please, for a second. Let's just fix the framework. So we want it right on the edge. Maybe even slightly going. Another wire, please. That's fine. Perfect. Ahmed, you need to go back to England and get some more. Yeah. So I'm just thinking, where's my template? How's the pocket? Really? You're happy with it? So what are we going to do about the drains? Any ideas, anybody? Okay. Can you demonstrate, or should we?
Sorry, Dr. Walid, what drains are you talking about?
Well, we need a suction drain. Without a suction drain, we're not going to.
You're talking about the pocket for the
What, can I see
reconstruction.
your drains? What drains do you have?
So what drains do you normally use, Dr. Walid?
Well, about 4 years ago, we used to have fantastic drains made by Stryker. They were little vacutainers. They were so fantastic. They were silicon and gentle. And then they stopped making them. So now every ear surgeon is sort of coming up with ideas. And I just use a small mini vac drain. Ooh. Oh dear. What's the pressure in there? Does anyone know? Or? Yeah, I mean, one second. Let's check this out. Can you cut that? Actually, should we leave it just in case we need the last wire? Cut there? Mhm. One fresh blade, please.